My name is Bastian Freidrich. I work for Avarto Supply Chain Solutions. We are a 3PL logistics company. We are headquartered in Germany, but operating all over the globe. What are we actually doing here for the pharmaceutical industry? So we focus on the one hand side for pharma companies, but also on medtech and biopharma companies, and we operate their supply chain on their behalf. So what does it mean? So we take care about sourcing activities, we kit products, we provide control tower services, we store products in our own warehouses. So we have a depot with a network about 17 depots all over Europe, where we can store products in a temperature controlled environment, and we take care about transportation service as well. But in this case, we do it carrier independently. So we have integrations to a network of different kind of carriers where we choose the best carrier for our company's individual needs. And last but not least, for commercialized products, we also take care about financial services, so writing invoices on behalf of the manufacturer and managing the accounts receivables. Yeah, so the Open Accelerator community, it's like a community of interest where we want to create a shared problem awareness on supply chain related topics in the area of cell and gene therapies. So we bring together a small group of people, so about 60 to 70 people, who discuss once in a year, on the one hand side, best practices, where are certain standardization needed that we can serve more patients at the end of the day in a resilient supply chain setup. In this kind of group, we invite stakeholders all over the industry. That can be 3PL companies, carriers, logistics companies, packaging providers, cell orchestration companies, for example, track and trace companies. So really the entire Monty with the main target to discuss how we can operate on the supply chain more efficient, more standardized to serve more patients at the end of the day. The next event is taking place on the 16th of May in Frankfurt. The participation is free of charge, so we do not want to gain any money out of it. So it's really creating a place for exchange, building new relationships among the industry. I think it was a really inspiring event this year again. So a lot of very interesting talks here. And I think what everybody observes, so that we need really a collaborative approach here. So many people and companies understand that we need to create a powerful ecosystem, that we have to work closely together, even though sometimes it's necessary to work with competitors together. So I think somebody named it that it's a competitive environment, but also that we need to, cooperate a bit more. And I think the wording co-opetition really summarized it quite well. So, and yeah, for sure, we always have to think about that the patient is really at the center of action, and therefore, I think cooperative work here is really quite well established, and that we have to foster it here a bit more in the future.